Hola, muy buenos días.
Hello, good morning and good afternoon from the headquarters of the Pan American Health Organization, PAHO in Washington, D.C. Welcome to this press briefing on the COVID-19 pandemic. My name is Luciana Viega, um, Public Affairs Advisor at PAHO, and today is Wednesday, December 8th, 2021. We have simultaneous interpretation as usual into English, French, Spanish, and Portuguese, and you can find it in the interpretation button. We have received questions via email, but we will have questions during this session, which you can place on the Q&A button. Please give us your name and outlet when you send your question. Today, Dr. Carissa Etienne, Director of PAHO, will give some remarks about the status of COVID-19 and the status of the Omicron variant and the status of vaccines in the region. Dr. Jarbas Barbosa, Assistant Director of PAHO, is with her, as well as Dr. Sylvain Aldeguieri, Incident Manager for COVID-19, as well as Dr. Jairo Mendez, Advisor on Emerging Viral Diseases. I invite now Dr. Etienne to give us her remark. Dr. Etienne, over to you for your remarks.
And thank you once again for joining today's press briefing. Over the last week, there were over 782,655 new COVID-19 infections and 10,950 COVID-related deaths reported in the Americas. In North America, cases are increasing in Canada and parts of Mexico, such as Baja California. In the Caribbean, Trinidad and Tobago continues to experience jumps in COVID cases, hospitalizations, and deaths. Other smaller islands, like the Cayman Islands, are also witnessing increases in COVID infections. Sorry. Except for Panama, Central America is experiencing a steep decline in COVID infections. In South America, Bolivia, Peru, and Colombia continue to see a steady increase in COVID cases, while Ecuador, Chile, and Argentina are reporting a drop in COVID infections. PAHO is monitoring the spread of the Omicron variant in our region. Omicron has already been detected in several countries, including Argentina, Brazil, Canada, Chile, Mexico, and the United States, although it's just a matter of time before the variant circulates in more countries. The arrival of a new variant doesn't necessarily mean that things will be worse, but it does mean that we must be extra vigilant in the short term. Research is ongoing to better understand Omicron's behavior and the potential risks for our region. In the meantime, we must not forget that we are already dealing with the Delta variant, which is highly transmissible. And that's why it's important that countries continue to leverage the full package of public health measures that have proven effective against this virus, including hand washing, mask wearing, and social distancing, and that people get vaccinated when it's their turn. Vaccines remain a critical tool to reduce hospitalizations and deaths and to limit the appearance of new variants. So today, I want to offer an update on vaccination efforts in our region. So far, 55% of people in Latin America and the Caribbean have been fully vaccinated against COVID. And while this number is a testament to the efforts of countries in the region that have been working hard to secure and deliver the doses that they need to protect their populations, there are still too many people who remain unvaccinated. 20 countries in our region have yet to reach the WHO's year-end 40% vaccination coverage target. And while we expect that some of these remaining countries will get there in the next few weeks, Guatemala and several Caribbean islands like Haiti, Jamaica, and St. Vincent and the Grenadines remain far behind. At the current pace, as many as 6 countries may not meet the 40% year-end target. Let me assure you that PAHO is doing everything that it can to accelerate vaccinations in our region. This week, more than 1.6 million doses are being delivered to countries in our region, completing a total of 72 million doses so far. And we expect more doses to arrive in the coming days. In the short term, we are racing to get people protected from this virus. But COVID will require a long-term strategy, especially as we learn more about the duration of protection, the impact of the vaccine on different age groups, and the behavior of new variants. PAHO's vision is to ensure access to COVID vaccines for everyone who is eligible in our region. And to fulfill that vision, we need to use our proven and sustainable mechanisms to secure vaccines now and for years to come. The PAHO Revolving Fund is a mechanism with a 40-year legacy that purchases all routine vaccines for 42 countries and territories in the Americas, including COVID vaccines. For example, this year, we are completing the delivery of 34.8 million doses of seasonal influenza vaccines for 33 countries. Leveraging on this legacy, we will continue to facilitate access to COVID vaccines on behalf of countries in our region, to complement the doses that they already secured via COVAX and through donations or directly from manufacturers. This year, the Revolving Fund has already purchased for our region more than $1 billion worth of all routine vaccines, including COVID-19. And we expect to buy even more as countries place their orders. PAHO has secured deals with AstraZeneca, Sinovac, and Sinopharm, and we expect to have mRNA vaccines in the portfolio as well. We're currently reviewing orders for next year, and it's not too late for countries to request additional doses. By using our revolving fund, countries are guaranteed access to quality assured vaccines at fair prices through a transparent mechanism. Countries can also benefit from the fund's credit line, and they can save the time and effort that it would take to negotiate individually, to manage orders, and oversee the international logistics of deliveries. As we secure these doses in the short term, PAHO is also investing in the future by advancing the development of mRNA hubs in Argentina and Brazil to enhance this region's ability to manufacture vaccines. As vaccine supplies improve, countries must, however, not forget the most vulnerable. PAHO has been working with countries to organize immunization campaigns to reach populations in rural, remote, and harder to reach areas, such as in border communities, where a clinic or doctor may be many kilometers or even days away. Countries are also working to reach those without easy access to transportation to health services in urban areas. Vulnerable groups like our indigenous peoples, the elderly, and those with existing conditions that leave them at higher risk of severe COVID should be first in line for COVID vaccines. Unfortunately, this is not the case in some countries for a variety of reasons. In several countries where overall vaccine coverage is high, like in Anguilla, the United States, and Bermuda, vaccination coverage among people over the age of 60 is lower than other groups. So many elderly people remain unprotected. In other countries where vaccination are further behind, like Jamaica, Nicaragua, and Guatemala, vaccinations are underway for everyone. So many young, healthy people are being protected before the elderly populations. This lack of prioritization is perilous because it keeps our elderly vulnerable and our health systems at risk. And that is why we urge countries to ensure high coverage within their vulnerable groups first. As we near the end of the year and countries are deploying more doses to reach the WHO's year-end targets, we continue to make a call for equity and preparedness. We need a reliable supply of doses so that our COVID vaccination campaigns do not widen the inequities that have long divided our region. And countries must prioritize and accelerate vaccine rollout because we just cannot afford to leave anyone behind.
Thank you very much, Dr. Tien, for the update. A follow-up question that we received from a number of media. With vaccines, why haven't we been able to stop the COVID pandemic? Why have we not been able to stop the COVID pandemic?
So let me thank you for this question. I think the simple answer is that we have not yet applied enough vaccines in our countries. And of course, therefore, we need to improve this. The other part of the answer is that in too many instances, people are relaxing public health and social measures and increasing their risk of infections. Let's face it, we have community transmission of this virus in every country in the Americas. And we need to interrupt this transmission first. That means that people have to do everything to protect themselves. To achieve our goal of reaching herd immunity, or even the first 70% of the populations with a COVID vaccine, the countries need to step up their work on all fronts. PAHO's revolving fund, as you said, is helping make vaccines accessible to all, but it is imperative that every effort be made to reach the 40% goal, at least before the end of this year. And then by mid-2022, to reach the 70% goal. And even then, we are not sure that the 70% goal will get us to end the transmission or the herd immunity that we are looking for. It may well be higher than that. The countries, I think, can improve vaccine acceptance with community outreach and other strategies. And health ministries, like in the Caribbean and other areas, have started creative ways of doing this. Some countries are highlighting positive stories to combat vaccine hesitancy. Others are working with religious leaders, and still more are using text messages to reach people with vaccine information. But let all of us note, it really is important that vaccines can prevent you from getting severely ill or dying from COVID. And we need people to understand this. And we need people to understand that we need all of our populations who are eligible, we need them to be vaccinated. And if we do that and follow our public health measures, we will get to the point where we can end transmission.
Thank you very much, Dr. Tien. Pasamos entonces a otras preguntas. Nos quedamos con
Now
las
we go to other questions. We have a question from Aliena Dieste from AFP. At the current rate, it's possible that even 6 countries of the region won't be able to reach the goal of vaccinating 40% of their population before the end of the year. And which are these 6 countries? Dr. Barbosa, please. Thank you for the question. Yes, this estimate is based on current vaccination rate, the number of doses that they are able to administer every day. It is an estimate that uh, we hope to reach, and we're working every day so that those countries that are lagging behind may have more health centers, more vaccines every day, more participation from the community so that they can increase the rate of vaccination. Right now, Haiti, Jamaica, St. Vincent and the Grenadines, Guatemala, St. Lucia, and Grenada are the 6 countries at this point in time that at the rate they are today, they won't reach the 40% target. The most concerning situation is Haiti due to the earthquake, the political crisis, everything that has happened in that country. And therefore, their vaccine coverage is very low. We hope that if the pace is increased in the other countries, then maybe we still hope that they will reach that 40% target by the end of the year. Thank you, Dr. Barbosa. Now a question about Omicron from
The question is, how much time does it take to identify variants, since there's the time needed for the sequencing plus other organizational aspects? How many days to know? And then she also asks, how about small countries that might need to send samples to other countries? Dr. Aldigueri, Dr. Mendez Rico.
Yes, thank you for these questions. I will try to provide you with an overview of the surveillance in our region, and after we'll give the floor to Dr. Mendez Rico, who is the PAHO subject matter expert on viral diseases. First, I'd like to remind the audience that in the region of the Americas, we have built since 2020 a genomic surveillance network for SARS-CoV-2 to ensure that all countries, even those countries with limited capacity for sequencing, all countries have access to regional reference laboratories where samples are processed and the sequences are generated and the decision makers are informed. Thanks to 7 sequencing reference laboratories covering North America, Central America, South America, and the Caribbean, and the active participation of most of the countries, more than 170,000 sequences from all these regions have been uploaded in the global database that is called GISAID, and we have been able to detect and follow all the variants of concerns, all the variants of interest, and several other common variants. However, please take into consideration that even in a period of relatively low transmission, the genomic surveillance systems capture only a fraction of the strains that are circulated. And this is normal, as countries and laboratories cannot sequence all cases confirmed by the national laboratories. So now I think it's time to give the floor to Dr. Mendez Rico. Over.
Thank you, Dr. Aldigueri. Yes, it is true that the complete genome sequencing and characterization process may take between 1 and 2 weeks to be completed. And it is a very specialized process that cannot be conducted in all laboratories. Nevertheless, we have already implemented molecular screening protocols to early detect the possible introduction of different variants of concern. These protocols are currently being adapted to detect Omicron, and together with the epidemiological background will be very useful to rapidly alert the presence of the variant while the confirmation through the whole genome sequencing is performed. It is important to always have in mind that regardless of the variants, all the public health measures already implemented to limit the transmission of the virus, including, of course, the social distancing and the use of masks in closed public spaces, and the vaccines to reduce the risk of severe disease, are still extremely efficient and therefore should be maintained and reinforced. We don't have to wait for Omicron to be detected to do what we have to do. We have the tools to avoid the spread of the virus, and we have to use them. Thank you very much.
Yes, yes. Thank you, Dr. Aldigueri, Dr. Jairo Mendez.
Thank you, Dr. Aldigueri and Mendez Rico. Now another question from Omicron, Susana Roca from El Independiente from Guatemala. She wants to know whether you have information about the symptoms from the new variant and what could be the complications health-wise. Dr. Aldigueri, thank you very much for your question. I would say that it is very early to be able to safely answer whether there are clinical differences between the Omicron variant as compared to other variants regarding symptoms and others. Initial reports that it can be milder are still premature and they need to be analyzed very cautiously with the indication that if this Omicron variant is more transmissible, the infectivity of infection by Omicron and the natural immunity post-infection, as with other variants, will appear. What I mean to say is that we need to analyze whether the reported symptoms reported by some researchers in Europe and other places are milder because patients were vaccinated or have already been infected by the virus in the last few months. In addition, what we see in imported cases from Europe and in the Americas, for the time being, are cases in young adults, which, as we've seen in our experience, have fewer complications as it is. I hope I have answered your question. Thank you very much. Thank you, Dr. Aldigueri. Now the next question from Cynthia Torres, a journalist from El Confidencial. She asked, what implications are related in the appearance of Omicron in controlling the pandemic, especially in countries with small vaccine coverage as Nicaragua? Dr. Barbosa, thank you for your question. PAHO last week and this week has given updates and what we know about the Omicron variant, and we have underlined that it is necessary to wait a couple of weeks to know and have all the information regarding the protection that vaccines can give to people who will be infected with the Omicron variant. As far as we know today, it is recommendable that we continue to vaccinate and that we continue to implement public health measures and social measures. Vaccines are going to protect. There may be some change in protection, but with those vaccines we have today, and remember that Omicron is just beginning, but as our colleague, Dr. Aldigueri said, as well as Dr. Mendez Rico, the Delta variant is the predominant variant. And for the Delta variant, vaccines are very effective to reduce serious cases and deaths. There's no doubt about this. Secondly, Nicaragua has progressed a great deal in vaccination. A couple of weeks ago, Nicaragua was around 10% or lower vaccination coverage, but now there is more vaccination and information is being sent more quickly to PAHO. Nicaragua has reached almost 35% of their population with a full schedule. And this is possible thanks to COVAX, which is shipping vaccines to Nicaragua, and some countries that made specific donations for Nicaragua. So all countries need to continue with their vaccination so that they can protect the most vulnerable people, and then continue with others in prioritization from most vulnerable to less vulnerable. Meanwhile, you should always maintain the public health measures. Thank you. Thank you, Dr. Barbosa. Next question in English.
Cartwright, apologies, from the Tribune in the Bahamas, asks, has Omicron been identified in the Bahamas, and how can health officials prevent it from spreading it there, and how dangerous is it? Dr. Mendez Rico?
Thank you very much for that question. First, I would like to mention that the Bahamas has been very active shipping samples for genomic sequencing to either of the reference laboratories from the PAHO Genomic Surveillance Network, and that allows us to follow what variants are actually circulating. So far, the Delta variant is predominating not only in the Bahamas, but also in all of the Caribbean subregion and in the Americas. Regarding specifically Omicron, we don't have any evidence of detection or any signal of circulation in the Bahamas. On the other side, until now, we don't have information to think or to infer that this variant is more dangerous. In fact, most of the cases so far have been detected in mild or even asymptomatic cases. Of course, as Dr. Adiyeri already mentioned, we need more evidence regarding clinical facts, and this information is still to be collected during the next weeks. It is important to remember that regardless of the variant, the virus is still the same. The transmission mechanisms are still the same, and therefore all the public health measures already implemented to control the spread, including the appropriate use of masks, especially in closed public places, the social distancing, isolation of cases, and of course, the vaccination are still the most efficient tools to limit the transmission. So maintain them and reinforce it should be the priority. Thank you very much.
Thank you, Doctor. Next question, Mariana Soquet, efecto Cucoyo, Venezuela. La pregunta en español, ¿llegarán más vacunas de COVAX a Venezuela este año? ¿Y qué papel tendrá la vacunación de refuerzo?
Will there be more vaccines arriving to Venezuela? And what will be the situation with the Omicron variant in Latin America? There will be more vaccines arriving to Venezuela. Venezuela has already received about 5.9 million doses through COVAX, and we are already negotiating to send to Venezuela in the first week of January about over 6 million doses vaccine. So Venezuela will be receiving 2 shipments in January that will be supporting their vaccination efforts. Second, what would be the role of vaccination in containing in booster vaccination to contain the variant? Well, they're talking about the third dose of vaccination, the booster. We know that for Delta and quite likely for all of the other variants, it is very important to continue with what we have, the recommendation we have from WHO. For all of the vaccines, the individuals that have some sort of underlying issues with their immunity system, they need to have the third dose. HIV individuals, any individual that may have a compromised immune system, and the individuals who received the vaccines produced by Sinovac or Sinopharm older than 65 years of age also need a third dose, because trials have clearly shown that after 6 months, immunity diminishes significantly among the elderly. So those are the recommendations which are valid today to protect the individuals today against the Delta variant, and certainly they will be important in the upcoming months when the pandemic will still be in circulation. Thank you. Thank you, Dr. Barbosa. We have a follow-up question on third dose. Lydia Lopez with La Prensa in Nicaragua. Lydia is asking me about the recommended period for the application of the third dose and whether that changes based on the time of the type of the vaccine. Yes, it does vary. And WHO recommendation is, and after the recommendation by SAGE, the independent group of experts on immunization, have 2 recommendations for all of the individuals who have some sort of underlying immunological problem, need to receive a third dose 3 months after the second dose. For individuals older than 65 that received Sinopharm or Sinovac, a third dose of any vaccine available can be administered within 3 to 6 months from the second dose. The countries with that period may plan accordingly, whether they have more access to vaccines, they can diminish the period, and they do not need to use exactly this period. So they need to adapt this to the availability of vaccines in their own situation. Thank you. Thank you, Dr. Barbosa. The next question is by Violeta Vilar from Health Web in Panama. She would like to know, how can you explain the increase in the number of deaths and cases in Panama? Dr. Aldigueri, thank you very much for that question from Panama. First of all, I would like to underscore that Panama is reporting all of the information by following the international health regulations and also providing PAHO coverage information. In Panama, we see that the number of cases has had a discrete increase, which is not related to the number of deaths. When we see the increase in the number of cases and we compare this to the same period last year, that is to say before vaccination, we see the great difference not only in number of cases, but also in number of deaths and hospitalizations in the general wards and also in ICUs. To date, the country has attained vaccination coverage greater than 80% with 2 doses in the target population, that is to say the one that has the highest risk based on the national vaccination policy, and almost 64% of the general population. The impact of vaccination in Panama is quite clear, mainly based on the hospitalization data and ICU data. However, there is still a gap, in particular among the teens who are unvaccinated, and much has been done to reach to the indigenous populations. It is also important to note that the country has also relaxed some of the public health measures, even though they maintain the mandatory wearing of masks in public transportation and also physical distancing and hand washing. The strategy that includes contact tracing and traceability is maintained in Panama, and the Orgaz Institute is also carrying out the genomic surveillance of the virus in Panama, in addition to also supporting the same genomic surveillance as a reference center for Central America. I hope I have addressed the questions by the journalist. Thank you, Dr. Aldigueri.
The next question in English from Terry McCoy, the Washington Post correspondent in Brazil. Terry asks, the city of São Paulo announced last week that more than 100% of its adults have been vaccinated against COVID. It's apparently a city where everyone got the vaccine. He wants to know what that means. It seems to be a test for both how the virus will act in such an environment, but also how the people inside that environment will act following such a high vaccination rate. He is curious to know whether we have heard of any other major metropolis with such a high, extremely high vaccination rate, or if this is the first. Dr. Barbosa?
Thank you for this question. We have some countries in our region that have made a tremendous progress. Chile and Uruguay, for instance, they have already more than 80% of their population vaccinated against the COVID. So probably in Santiago, in Montevideo, we have a very similar rates to this one that you present in São Paulo. Brazil has also made a very important progress. I think that this is in Latin America and in Brazil and many other countries in Latin America, there is a very important trust from the population on vaccines and the immunization programs. So these are supporting the efforts that the Ministry of Health, the government have made. Second, but let me tell you that you need to have some concerns about the situation, because one can see, okay, they have vaccinated everybody, so the pandemic is over. No, this is not true. First, because São Paulo used at the beginning the CoronaVac vaccine that is produced by Sinovac. And as is, I already said, and it's recommended that every people that at 60 and older that receive the coronavac needs to get a third dose to be considered as fully vaccinated. Last time that I checked the data, not in São Paulo, but in Brazil, probably 60% of these people had the third dose. So we still have many people that need to get their third shot to be fully vaccinated. Second, that the protection provided by the vaccine is not enough to interrupt the transmission. We need to keep also the public health measures, wearing masks, avoiding crowded, enclosed spaces, because it is well known that people that are vaccinated can transmit the virus. The transmission is reduced, but they are still able to transmit the virus. So for this reason, congratulations to São Paulo, to Brazil, to the countries in Latin America, but we still need the people that had the coronavac vaccine to get the third dose if they are 60 or more, and everybody still needs to keep the public health measure until the community transmission has stopped. And this is not, unfortunately, the case. It's reduced a lot, what's very good, but we still have some level of transmission. And you need to be very cautious, of course, with the new variant of concern, Omicron. So let's keep all the public health measures until we know more about this new variant, until the transmission is really controlled. Thank you.
Thank you, Dr. Barbosa. La próxima pregunta, una pregunta de seguimiento también de Alina
The
Dieste.
next one is a follow-up question by Elena Diester from Fram Press. Through the revolving fund, PAHO was able to attain agreement for buying AstraZeneca, Sinopharm, and Sinovac, which is the messenger RNA vaccine that is PAHO expecting to have in its portfolio? Is it Pfizer, Moderna, or both? And when do you expect to have an agreement? Thank you very much for this question. When this initiative was launched, it was an initiative to supplement COVAX. COVAX in most countries has requested about 20% of their of vaccination for their population. And we know that 20% is not enough. 20% only protects those groups that are the most vulnerable, such as the elderly, individuals who have chronic diseases, and health professionals. So that this alternative, that is to say, we already have some agreements that have been executed, and we will start delivering some vaccines. For example, this agreement will allow migrants who are in countries such as Colombia or Ecuador may receive vaccines immediately. And we're also about to execute an agreement with an important mRNA producer. I cannot tell you what producer it is. We would like to sign with both, but right now we have also made we have also attained advanced negotiations with one of them. We want to have it at a reasonable price. We have advanced negotiations to provide these vaccines for the countries that are interested in administering it in their territory. Thank you very much. Thank you very much, Dr. Barbosa. We have a question by Carolina Marians from the Estado de Sao Paulo journal. She's asking, with Omicron, much is being said about poor countries with low vaccination rates, but some in Latin America, such as Ecuador, Nicaragua, and Costa Rica, have not been able to attain good number of vaccinated, even though they are rich. How can we explain that? What was PAHO's what did PAHO do, and also was it important also in terms of reverting these trends in these countries? Well, when we're talking about countries that are not rich, we have a very important comment to say. It is different to be a mid-income country than to be a low-income country. It is very different to talk about Haiti or Costa Rica. The ability the government has to buy vaccines and also the purchasing power are different. In Africa, for example, We have an average of only 5% of the population that is completely vaccinated. In South Africa, that is one of the countries that has vaccinated the most in Africa, only 24-25% of the population has been completely vaccinated. And in Latin America, we have, and also in the Caribbean, we have, I think, two important factors. First, there is a great trust of the population in the vaccines. Whenever there are available vaccines, the population will use them. And second, we're trying to offer countries several alternatives. First, the COVAX alternative, which is very important for the countries in our region. Second, we also offer the direct purchasing option through the revolving fund. And third, we also had very strong advocacy with the donors such as Canada, the US, France, Spain, and Japan. And that is very important over the last 2 months. It was possible to expand the arrival of vaccines to the countries due to the donation. The donations account for about 30% of all of the vaccines that were delivered in the region through COVAX. So we thank donors, but it is necessary to have more vaccines so that all of the countries attain 40% by year end and 70% of coverage by the end of the first 6 months next year. Thank you. Thank you, Dr. Barbosa. Now we move on to a question by Gerson Collave with El Comercio in Peru. Jason has two questions. The first one is the last shipment of COVAX to Peru was on November 10th. Will there be another shipment before the end of the year? And the second question is whether there is any plan from PAHO to have countries in the region have access to new treatment for COVID-19 patients that are currently available only in the United States and Europe. Dr. Barbosa. I am going to share, or I am going to split that question into two sections, and then Jairo and Sylvain may add to it. In connection with treatment, generally, we have at PAHO a strategic fund for medicines that is a mechanism for regional acquisition, which is shared. And that mechanism has already purchased 32.8 million PCR and antigen tests for the countries in the region. Also, some countries bought through the strategic fund the drugs that are used, for example, for intubation in ICUs, and these are medicines that were also very significant. But for us to be able to offer treatment, we need to be certain that these are treatments that are effective against COVID-19. I'm going to ask Sylvain or Jairo to add any comments that they deem relevant in connection with effective treatment. And as to Peru, Peru has already received more than 4 million doses through COVAX, 4.1 million doses, and they have more than 0.8 million Pfizer vaccines that have already been accepted by the country. We are also negotiating with the country to inform, and the manufacturer to inform the Ministry of Health of the date and flight when the vaccines will arrive. As Dr. Barbosa has mentioned, I will be updating briefly on treatment regularly, and I think that for more than 30 times from the onset of this pandemic, PAHO publishes evidence on therapeutical options, and this analysis is available on the public website PAHO has. I can tell you that this is a real-time evidence review. I apologize for my choice of words in English and Spanish, but this is what allows us to consolidate and also advise ministers of health to be able to determine standards of care. For example, with anti-clotting device medicine, and also treatment including dexamethasone in severe patients, and also patients who are receiving oxygen and other medicines. These are very detailed pieces of information that are available on PAHO's website, and I would like to underscore the need that the doctors have, as well as the ministries of health, to review the information for the guidelines for the primary care level that have been developed during the first year of the pandemic in 2020. In many cases, it is necessary to review that information because many therapeutical options have been discarded. A clear example is the use of chloroquine that has been discarded by WHO and PAHO in all of in all of their documents, and I hope I have added to what Dr. Barbosa previously said. Thank you, Dr. Aldigueri. We have here a question by Gisela Solomon on the vaccines. When could COVID-19 vaccines be produced in Argentina and Brazil? Will there be availability next year? How many? And any update on this initiative? Dr. Barbosa. Thank you. Thank you for the question. I know that there is a great deal of interest in this topic, and this is a strategic topic for the region. Our director has underscored the vulnerability of the region, and also the leader has led this process. The mRNA vaccines are vaccines that may be used against other diseases in the future. This is a long-term project. This is not something that will happen this year or next year. For example, in the case of Brazil, led by Fiocruz, this is not technology transfer. This is a vaccine that was developed at Fiocruz. That is to say, the principle is that there need to be clinical trials to later on be approved. The Argentinian consortium is also making a very significant investment to expand their production capacity, and they do need a partner. So this is a strategic approach to make sure that in any potential upcoming pandemic, the region has the ability to produce and use those vaccines for the region. This is a long-term strategic project, and all of the measures are being taken so that this is feasible and sustainable as time goes by. Thank you. Thank you, Dr. Barbosa. We're almost at the end of our session today. We have a question, a final question in English by Joaquin, BBC World.
Variant Omicron, how advanced is the variant Omicron in South America, and what are the risks the region faces from this new variant? Dr. Tien, please.
Thank you for this question. And I know today that you've asked other questions on the Omicron variant. Of course, Omicron is one of the 5 variants of concerns that have been identified in the Americas. The Delta variant continues to be the predominant variant in our region. But let's be clear that all variants can cause serious illness or death. It will take some time yet to understand the severity and transmissibility of the Omicron, but we recommend that member states continue their efforts to increase vaccination coverage for COVID-19. As you've heard over and over again in these briefings, but also today, we also strongly suggest that countries improve adherence to public health measures for reducing the SARS-CoV-2 virus transmission, and especially now at this holiday time. We know that people may be tempted to congregate in large parties, to celebrate with extended family, to go to bars for drinks with friends, and other things that we normally do on holidays. But please let's remember that we are not out of the woods yet. We have a dangerous virus that is circulating in our countries, and we do have to protect ourselves from getting infected. And it is, as we've said over and over again, it is still critical to abide by protective measures, including mask wearing, physical distancing, ventilation, the avoidance of closed spaces, and hand hygiene. We see that from survey data that as vaccination coverage increases, that the observance of masking and social distancing decreases. And we have seen how the relaxation of these public health measures in the past have led to renewed waves of infection. And we really don't want this to happen again. So let me implore, celebrate your holidays safely. Keep wearing your masks, open windows to circulate air, and keep a safe distance of 1 meter or more from others. Wash your hands frequently and get vaccinated when it's your turn. Please let us all stay safe during this holiday season, and let us continue to do what we know works. So thank you again for joining us, and we will see you next week.
Thank you very much, Dr. Tien, for the final words. Colegas, llegamos ahora al final de nuestra sesión.
Colleagues, we have reached the end of today's session. Please remember that you can find more information on COVID-19, the figures, among other pieces of information on our website, and also send us follow-up questions to media team at @paho.org. And thanks again for sending your question, and see you next week. Thank you very much.